Everyone, good morning. Here we are. It's just after 11 o'clock on your Thursday morning. I'm Ed Drantch. I anchor the morning show on Channel 7 every day. Thanks for following along here on Instagram. Here we are. For those of you who are keeping score at home, this is Instagram Live interview number 4 of 4. We started off doing an interview with Dr. Gail Burstein talking about the coronavirus in Erie County. Then we switched to small business and the impact of the CARES Act and the stimulus bill and those small business loans. Then last week we interviewed Karen Brown, who's the director of admissions at SUNY Oneonta, to see what the coronavirus impact would be on SUNY schools and colleges throughout the country for that matter. Today we're focusing on the hospitals and the frontline workers, and I want to loop in our friends at Erie County Medical Center. And I see that our friend Peter Cutler is here watching. And Peter, thank you so much for joining in. I'm trying to connect you here. Let me just loop you in. We'll add you into that list. He actually is a spokesperson for ECMC, but we're going to be speaking with Tom Quatroche, who's here with us this morning. Hey, Tom, good morning to you. Thank you so much for being with us. We appreciate you. How are you?
Good.
Good. I'm glad to hear that. Thank you so much for being so generous with your time today. I know that you must have a lot going on over there at ECMC, but it's really cool that you're able to just take a moment and chat with us here on a different platform to try and reach a different audience. And I know a lot of people around Western New York certainly appreciate that. So I want to just jump in here. I'm reading the latest statistics that I have about the coronavirus at ECMC. 36 confirmed cases in-house, but 20 of those cases are on ventilators. Talk to me about the conditions inside the hospital right now.
So, first of all, I mean, as you know, the frontline staff have been just incredible. They are the ones coming in here every single day, very selflessly, taking care of these patients and all of our patients in our building. It's calm. They're professionals, and we always provide a very high level of care. But they're anxious. Obviously, they want to make sure that they protect themselves and their families. We've taken every precaution to be able to do that, whether it be PPE or letting people stay in hotel rooms that if they don't want to go home after taking care of a COVID patient. So we've made many accommodations for our frontline workers, but they are the heroes. As you said, there's 20 out of about 30 patients right now. We actually went down a little bit on the amount of COVID patients we have who are on ventilators, and those folks are very sick. Obviously, they're critical, and at the end of the day, we've had some success of getting some folks off of the ventilators, about 3 patients off of the ventilators, but it is obviously a very critical time for those patients. So the patients that we do see that are older do obviously have more problems with the COVID virus or have underlying health conditions. So it's obviously very stressful for the staff because they're trained to heal, and in many cases they're not able to really do anything other than care for the symptoms. On a positive note, we have discharged 33 COVID patients who have recovered, but obviously we focus on healing, but there are people unfortunately that are very sick from this virus.
So let's talk about the people that you're seeing. You mentioned that a lot of the patients who are on these ventilators are older. Are you seeing people of all different age demographics coming in?
We have. Again, if people have underlying health conditions, regardless of their age, they're going to have issues, and mostly respiratory or cardiac. So it varies. I think the virus is so new. I think the clinicians are really still learning about how it affects people and really who's going to be most severely impacted by it. So obviously for all of us, we've seen the fact that many folks that have underlying health conditions are older are the ones that are having issues, but there have been instances where people who seemed otherwise healthy have not done well with the COVID virus.
And I think that's probably what's most startling for so many people is that it, at first almost acted at random. We were seeing people with underlying health conditions, older people, then we were seeing younger people, then we were seeing, middle-aged people. I mean, it doesn't discriminate, it seems, at this point. And I wonder if that's actually what you're seeing.
Yes, somewhat. And it's similar to the flu, right? So the flu, if we were sitting every single day watching flu numbers, it would be just as startling to us. Now, the difference is with the flu is that we have the ability to give vaccines. We have the ability to treat somebody with Tamiflu if they do come down with the flu. But there are instances where we had this year a young man die of the flu. So it's any of these diseases, as you say, they do not discriminate. And at the end of the day, the scariest part about COVID for everyone is the unknown and the fact that we really don't have a way to either provide a vaccine or treat it as of yet.
So what are you guys doing in terms of testing? Because obviously that seems to be the biggest factor here. Can you talk about the level of testing that you have and perhaps what the future might look like?
Absolutely. So obviously testing's been a challenge, obviously not only in our community, but across the state and across the nation. We want to obviously all get to a point where we can test anyone in the community that wants to test. We just got up and running with regard to testing. Our very innovative and ingenious lab staff actually worked with a company in Germany to create an assay to begin to test. So we'll be able to pretty soon test about 200 people a day. But we've been working with Kaleida, they're our partners, and Kaleida has ability to test right now, so we've been working with them. But it's really for, at this point, people who are symptomatic or have come in close contact and have a primary care physician's note. Those are the folks that can get tested. And of course, people who come into the ER who are symptomatic or are inpatients would also be people that would be tested.
So what about those frontline workers? Are they being tested as well, or are they being tested every so often?
Yeah, we've had a significant amount of our workforce be tested for various reasons. We've had about 30 employees test positive, and which is pretty remarkable if you think about it. We have 4,000 employees for only 30 employees to be tested positive for COVID. We hope it stays that low. So that's been great. But we have tested, I believe, by almost 300 employees at this point.
So let's just talk about those frontline workers for a second, because they are seeing the dramatic way that this virus kind of takes control of your body. And, for having 30 of, many thousands of employees test positive here, what does that say to you? I mean, are you taking certain steps that seem to be working, or is it just, a mitigation process?
Well, no, I think it's the steps that have been taken. So early on, we worked to make sure as many employees as we could work from home. So we actually have about 350 employees. It's hard to do in a hospital. Actually work from home. So these are more administrative staff. We went to universal masking even before the state asked to go to universal masking a few days before. So we've been taking steps, treating every patient who has COVID-like symptoms as if they had COVID. So we've been taking many steps along the way, and obviously our staff are more acutely aware of the risks associated with COVID. So I'm sure they've been taking their own steps, whether that be at home or elsewhere. So I think it's a combination of all those things, some of the steps we've taken, and obviously the awareness of our staff.
It's interesting that you point out some of those orders that were just recently put in place by the governor's executive order in terms of universal masking for everyone. I want to go back to maybe an executive order that was issued probably about a week and a half, 2 weeks ago at this point, where the governor had mentioned that there was going to be kind of a gathering of all of the ventilators and other PPE that perhaps wasn't being used or was in surplus in certain hospitals. Was there ever any interaction or any communication with the state or the governor directly about coming into Western New York and, rounding up some of the equipment and PPE to ship it downstate?
So initially, I think there was a lot of discussion around that. And when the final executive order came out, it basically gave the Commissioner of Health the discretion to work with hospitals. And I think, again, we're in the middle of a crisis. So I think things are set. And whether they were intended to mean have a certain meaning or not, at the end of the day, the executive order that came out basically says that the Commissioner of Health works in collaboration with the hospitals. What we liked about what eventually was put on the table was that this was an effort not to just grab all the ventilators, put them in some room and have them collect dust, but keep them in our facilities for a potential surge And then if they're needed somewhere else, we can have a discussion on what do our numbers look like, what does somebody else's numbers look like. And it's not only for New York City, it's also for if we had a cluster here in a nursing home or something. So the entire state had access to the additional ventilators, not just New York City, who happened to be seeing, obviously, a surge.
So on that same note, the same week or so that executive order came out, or the week prior, we're losing track of days and weeks here, there was some talk among hospital staffers and nurses, especially at ECMC, that there simply wasn't enough PPE to go around, or that, in a week and a half's time, you'd be running dry. So what's the status now, and is that still the case?
So yeah, and we joined the union with regard to their cry to the state and federal government for more PPE, because obviously, from my perspective, and we got there earlier this week, we wanted to provide anybody who wanted an N95 mask the ability to get one. So as of Monday of this week, we're able to say that because we were balancing between being able to provide that and making sure that the caregivers taking care of COVID patients actually had the protective equipment they needed. That's the ED, the ICU, the COVID floors, the heavily trafficked areas that would see those patients. So we were able to make that decision. We have about 4 weeks of N95 masks available. And obviously, we're using more now that we've offered it to our staff in other areas, but we're continuing to source those and looking for shipments for more N95 masks. And we think in the next month we'll be able to get that.
And is that through the state, or is that through the federal government, or is that kind of just on your own?
Right now, it's on our own. So
wow.
We're sourcing vendors, and like I said, we've had some success, and we've done some of that with our partners at Colada.
And so, what are you? I mean, so you've got 4 weeks right now. Are you still bracing for a surge? Are you expecting more patients to come through? I mean, we're seeing an uptick in certain hospitals right now, and that's something the county executive has mentioned several times. But what are you preparing for?
So we're continuing to prepare for that surge. We actually are opening 14 more ICU beds for our patients, and we're trying to. We have been really making sure we cohort the COVID patients in one area, and then obviously the patients who do not have COVID in another. And so we've been able to increase by 14. So we have a total of 62 ICU beds. So that's been good. But at the end of the day, we have to keep prepared for that possible surge. We're seeing a plateauing, and you'll see all kinds of different models. And trust me, we've talked to all kinds of people who've done all these different models, whether it be through the state or locally, or whatever the case may be. We're seeing consistently between 30 and 40 patients for this week and towards the end of last week. So, and the same amount of patients on ventilators, and actually the number of patients under investigation have actually gone down slightly. So wow. We're seeing a plateauing right now. Now, whether that's a plateauing that eventually will go up, or that's a plateauing that'll go down, or it'll stay like this for a few weeks, we don't know. So we're preparing for the surge. We're making sure that we have everything we need if that does happen. But it looks like at this point, based on everything that's been going on, and it kind of makes intuitive sense based on the actions we've taken to isolate ourselves, that we would have this kind of consistent number for a while. So the question will be, I think, long term for the government is, what if this number stays like this for 3 or 4 weeks? What if we consistently have between 30 and 40 patients? Is that what do they do at that point? So that's not something for obviously the hospitals to be deciding, but we're taking care of patients in our building. But it'll be an interesting discussion when that moves forward.
If that were the case, is that sustainable at ECMC?
Yes, at this level. I think the thing that's very difficult is we've stopped all elective work. So all our elective surgeries and outpatient visits, have gone down dramatically. So that's been a significant financial impact. You're going to see coming out of this, hospitals at varying levels obviously have financial issues. We're losing about $500,000 a day
wow.
just because of lost revenue and increased expense. And we're not unique. I've heard other hospitals quote numbers like $5 million a day across the state. So it's going to be a significant financial hit. Luckily, we've managed our finances well, and we're in a good cash position to be able to weather the storm, so to speak. But coming out of this, there's going to have to be some help for hospitals, because larger hospitals like ECMC or Colada, the Catholics, can weather these storms. I mean, think about a rural hospital that may have days of cash on hand. How they're going to survive through this process is yet to be seen.
So is there talk or at all any concern about layoffs or furloughs?
So I think right now we need our staff, and obviously for potential surge, we need them. And you don't want to, our philosophy is we don't want to get into that mode and then not have enough staff and not be able to recall staff or they go somewhere else or whatever the case may be. So our philosophy has been to keep everybody working, and they have been. We do have a significant amount of employees out due to COVID-related issues. It's a very small portion of our total employee population. It's about 180. I think it was 184 at last count.
Mm-hmm.
They're COVID-related issue. That either they're sick, a family member's sick, something, child care issues, whatever the case may be. We do have those employees out, but again, out of almost 4,000 employees, that's a small percentage. So, we're continuing to monitor it, but at this point, we're making sure that we keep our caregivers here.
So let me ask you this. I mean, obviously you are looking at models, you're looking at data, you're looking at projections. Is there a time where you can kind of say, okay, we're comfortable now if the state were to open up society again? Is there a time where you can say, 2 weeks down the line, 3 weeks down the line, a month from now, 2 months from now, where, somebody who is privy to all of the knowledge that goes on inside the hospital can say, okay, I think we're safe now?
Yeah, I think from a hospital perspective, it's hard to talk about from a community perspective. As they've said, it's not going to be a light switch; it's going to be a trickle.
Sure.
But I think from a hospital perspective, for example, starting up elective surgeries. I think if we have the ability to test and we have the ability to take precautions, we could do that. But we'd obviously have to make sure we could test everybody that's having surgery and take all those necessary precautions. So right now, the state has said we have to suspend all elective surgeries. Again, the decision we made prior to the state making that decision. But at some point, we need to turn that back on. People do need to receive care. So how we do that will be in conjunction with the Department of Health. And I just had a call with our physicians today who were asking that very question, about elective surgeries. But again, that's going to be in conjunction with the Department of Health. And I'm sure we'll have a lot of lead time before that happens.
Sure thing. As we kind of wrap up here, Tom, because I know that you probably have to get back to work, and the governor actually starts talking in just a little while, and I want to make sure that we get people in front of a TV for that too. Yep. You guys are a level 1 trauma center, so you guys handle all the majority of the shootings, the bad car crashes, and any other traumatic life event that might impact an adult around Western New York. So what have you seen in terms of an impact as a result of the coronavirus on level 1 traumas?
So obviously we still have our level 1 traumas, but people are isolating, right? So there's not as much trauma coming in. We are the #1 fracture care center. So what will happen many times is patients will go to a hospital in the community or an urgent care center, and they have a fracture that needs to be tended to immediately. They send it here because we have orthopedic surgeons on 24/7. So, those types of things have dropped off because people are not active. They're not out. But we do get a lot of also, everybody knows from television all about car accidents and shooting victims and those types of things. But, we do get all the sickest of the sick, and we have many, many hospitals that transfer intensive care patients to us from outlying hospitals. So that continues, and we continue to be busy around those types of patients. And fortunately, because of who we are as a level 1 trauma center, we do crisis well, and we're able to handle those types of things. But it's obviously those types of things we have seen a drop off. We've also across the community seen a drop off in ER visits. And I think a little bit of that is obviously people avoiding maybe coming to hospitals, but also not being connected with their physicians who would say, oh, maybe you should go to an ER right now. So what the long-term effect of that will be is yet to be seen, but we have seen that dynamic.
And I know you guys are doing telehealth visits also, or virtual
Correct.
ERs.
Yeah, I think that's going to be the new reality. I think people are going to get used to doing this. And I think whether it's in the ER or outpatient, behavioral health, which obviously is a huge part of what we do. We're actually we're the largest behavioral health center in New York State. Many people don't know that. And actually our visits, we've had less cancellations doing this than we've had actually in person. So I think some of those things are really going to stick, and I think will actually be beneficial for the community and for us being able to take care of patients.
Yeah, it's kind of like a new normal after what we've already experienced as our new normal throughout this pandemic. Tom, my final question here, the governor has said essentially over the last couple of days, what we do now will determine the future in terms of staying home, isolating, keeping that mask on, and that safe social distance. So what do you tell your nurses? What do you tell your physicians? And what do you tell the people who are watching right now about what could happen in the future?
Yeah, I think the precautions that we're taking are working. So I think that is the message, that we've seen this plateauing of patients. So if you look at 2 weeks prior or 2 weeks prior to that, we're starting to see this kind of leveling off. So the decisions on how we come back is really up to the state, and how we end up doing that. We know at ECMC are beginning to prepare for how we come back as an institution, but it'll be yet to be seen how the state addresses making sure that we come back to normal life without spreading the virus more. So that'll be yet to be seen. But in any case, we're prepared as an organization to be able to take care of Western New York.
Anything else you want to touch on, Tom, that you think anyone could take away and kind of say, aha, that makes sense to me?
No, nothing I can think of particularly. Again, the caregivers have just been phenomenal here. I mean, if you could imagine our own lives of coming home, and it seems like Groundhog Day every single day. There's only so many movies you can watch, but our caregivers are, obviously taking care of very sick patients, and also, coming home to their personal lives where, they have to obviously take care of their families. The other thing takeaway is the donors, the people that have been helping us with food and PPE. I think we have about over 250 donors now.
Wow.
That have come, and just being able to provide a meal to the frontline staff is one less thing they have to worry about, and it's been very impactful. It also, more so than even that, it just shows them and reminds them the impact they're making in the community for all of us. So just thank you to everybody in the community that stepped forward and really taking care of our frontline staff.
Yeah, I just saw from Rob Banks at WYRK that Zolad's Construction is actually delivering 350 meals to ECMC and the doctors and nurses on the front line. So that's pretty cool as we speak. Anything else that you think that we might want to, is the community, able to help in any way, or what do you need?
Yeah, I think the things that people are doing for the frontline staff are continuing to be needed. PPE equipment. I think, more importantly than that, obviously we sit in 14215, which is is a poor zip code, and in the city it's poor. I think we just need to continue to look out for our neighbors. There's many people right now struggling, and we need to continue to make sure we find ways to get people food. We continue to help those folks in our community who don't have the means to do the things that we can do when we isolate and do those types of things. So there's more info on our website, by the way, regarding COVID on ecmc.edu. But if people have questions or thoughts, whether it's coming here or elsewhere, otherwise. But at the end of the day, I think just making sure we take care of our neighbors is probably the best thing that people can do.
Great advice. Thank you so much, Tom, for being with us. I really appreciate your time. We're going to have a full story posted after this article a little bit later. After this interview a little bit later this afternoon on WKBW.com as well. So stay tuned for that. All right, Tom, thank you so much again. Stay safe, stay healthy, and send my best to all those frontline workers if you would.
Will do. Stay safe.
Have a good one.
Thank you.
Thanks. Bye-bye.